Human immunodeficiency virus, or more commonly known as HIV, is a condition that weakens and destroys the immune system and its cells. This makes a person prone to catching the infections and diseases more quickly. An advanced stage of HIV often leads to acquired immunodeficiency syndrome or AIDS. It is believed that people who have AIDS have a damaged immune system that it increases the chances of a person who has HIV to contract other diseases, illnesses, and even an opportunistic infection. Symptoms of HIV. There are several symptoms of HIV, and not everyone will have the same symptoms. It depends on the person and what stage of the disease they are in. The first stage is called acute HIV infection. The symptoms for this stage are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes. The second stage is called chronic HIV infection. People in this stage may not feel sick or have any symptoms. The third stage is called AIDS. The symptoms of AIDS includes weight loss, extreme and unexplained tiredness, diarrhea that lasts more than a week, pneumonia, sores in the mouth, anus, or genitals, red, brown, pink, or purple patches under the skin or inside the mouth, and memory loss and other neurological disorders. How is HIV transmitted and spread to another person? A person can only get HIV by having direct contact with body fluids from a person who is HIV positive. The fluids includes blood, semen, rectal fluids, vaginal fluids, and breast milk. For transmission to occur, the HIV in these fluids must get into the bloodstream of an HIV negative person through a mucous membrane, open cuts, or by direct injection. How is HIV spread from person to person? It can only be spread by having vaginal, oral, or anal sex with someone who has HIV. Sharing injection, such as needles, from mother to child during pregnancy, birth, or breastfeeding. Receiving blood transfusion and contact between broken skin, wounds, or mucous membranes. Treatment and diagnosis. HIV can be diagnosed through blood or saliva testing. One example of the test is antibody test. This test uses blood or saliva samples to help diagnose HIV. It usually takes 3 to 12 weeks after being exposed for it to become positive. Another example is called nucleic acid test, or also called as NATs. It involves getting blood coming from the vein. Currently, There's no cure for HIV, but treatments can help slow the progression of the virus to the body. Antiretroviral therapy is one of the considered treatments options for HIV. It involves the use of multiple medications to help with the progression of the virus. There are two types of HIV. HIV 1, the most common type of HIV. There are four strains of HIV 1. First is called the group M. It is also called as major. This group is more commonly known as the one behind the epidemic. Group N, there are not much cases revolving around this group. Group O, also called as outlier group, it is very rare. Group P, one of the newest part of HIV-1 group. Another type of HIV is called HIV-2. It is most common in Western and Central Africa. However, it has become more common in India. HIV does not only affect physical health, but the mental health as well. They are more at risk in developing mental stress from the disease because of the different factors, which includes discrimination and stigma that is associated with having the virus. One of the most common mental health conditions that people living with HIV face is depression. Symptoms include feeling sad or anxious all the time, feeling irritable, easily frustrated, having trouble falling asleep or staying asleep, eating more or less than usual or having no appetite at all, experiencing ache, pain, or stomach problems that do not improve with treatment, and having trouble concentrating, remembering details, or making decisions. It is important to talk to an HIV healthcare provider if you are experiencing any of the symptoms above. Your provider may ask some questions to assess how you are feeling and may prescribe medication to help with depression or anxiety, or even may refer to a mental health specialist. How to raise HIV awareness. Social media is a platform that is popular among the younger generations. Through social media, news and important happenings in the world can be broadcast in this area. Sharing posts about HIV awareness can help inform other people about the seriousness of the disease. Storytelling involves telling stories about or related to HIV to help spread awareness about this disease. It not only helps spread awareness, but it can also give inspiration and strength to other people who is infected by HIV. How to prevent HIV? Reducing sexual risk is one way to prevent HIV. It is important to practice safer sex. Practice abstinence, get tested, and being monogamous. Monogamy means being in a sexual relationship with only one person. If you tested positive for HIV, CDC recommends that you be in the care of a licensed healthcare provider. Your healthcare provider will assist you with treatment information and guidance.